Scan Health Can, the podcast where we explore the crucial role of healthcare supply chain. I'm Dana Trampus, your host. Each episode is a new chapter in the exploration of best practices, innovations, and advancements, ensuring that at the end of the healthcare supply chain, we prioritize the most vital element, human life. And understanding the people behind each link in the healthcare supply chain is crucial, which is why I'm incredibly excited for our guest here today. Can you introduce yourself and tell us a little bit about yourself?
Thanks, Dana. My name is Altaf Stationwala. I'm president and CEO of Mackenzie Health. I've been in that role for, hard to believe it now, almost 14 years. Been in a variety of different leadership roles in other organizations like Mount Sinai Hospital in downtown Toronto. And prior to that, I had a variety of executive roles at William Mercer Health Center. I'm not a clinician by background. I have an undergraduate degree in business administration from the Ivy School of Business at Western, and then a master's in health administration from U of T. But have spent my entire career working in hospitals, and obviously have seen all kinds of changes, some good, some not so good, in terms of how we continue to meet the needs of changing population needs and changing patient needs.
Can you share with us a little bit? You mentioned population health needs. Can you tell us about that around Mackenzie Health? Can you paint us a little bit of a picture of Mackenzie Health and what that looks like?
So we are just north of the city of Toronto itself, in the Greater Toronto area. We serve two large communities, Richmond Hill and Vaughan. So a combined catchment area of about 650 to 750,000. And what we face in our community is massive population growth. So in fact, that population growth drove the creation of a second hospital for us, Cordelucci Vaughan Hospital, which opened basically 3 years ago to the date in June of 2021. And it opened in a very interesting way. It opened in the middle of the pandemic. So we actually opened not as intended. So we opened a few months earlier in February, actually, first, exclusively as a pandemic response hospital. Wow. And only cared for COVID patients from other hospitals, from critical care and medical beds. So we cared for over 500 COVID patients from other hospitals, and a very unique time in the province of Ontario at that time. We were really stretched for healthcare capacity and specifically inpatient beds, and we were having to move patients as far as Ottawa and Windsor out of the Greater Toronto area just because we didn't have enough beds. So in that vein, we actually did very much save Greater Toronto area from, I think, a healthcare crisis by opening that way. But it points, I think, Dana, to a whole bunch of things that I don't think we appreciate, all the component parts that have to come together to deliver patient care. And it's obviously driven by physical facilities, it's driven by equipment and technology, it's driven by health human resources, which we know is very much challenged, but it's also driven by supply chain, which in many ways we take for granted that product or that piece of equipment will always be there the moment we need it. But I think COVID-19 really did educate us on just how precious supply chain can be and how precarious it can be in terms of its reliability.
You bring up the pandemic and the complexity of that. What were some of the key lessons that you had learned, and how has that been incorporated into your strategy from then until now?
So, I think we learned, but we had some sort of premonition to this, that, technology and healthcare technology would be critical in terms of having line of sight and visibility to many things. So we are fortunate here at Mackenzie Health that we made some strategic decisions many, many years ago around the use of technology. And one of those was really to become very advanced in the adoption of an electronic medical record. So in and around 2014, we made a decision to purchase the Epic system. And it's a good product, but it's not just the product, it's how you implement that product. So we had a concerted effort to engage and involve the front line and ensure that the workflows and the adoption of that electronic medical record was built by our clinicians and our frontline staff. So the build, the workflows, the adoption of capturing data. So we made a concerted effort to have barcoding and barcode capture at every transaction point. so that we were able to understand more clearly what was happening. So in our case, for example, barcode medication administration was a key strategy, and we've done very well. So to that point, we were the first acute care hospital in Canada to achieve the MRAM 7 designation. We won the Davies Award twice, which is a demonstration of the outcome and the adoption impact of an electronic medical record. I think we're the only non-American hospital to win it twice, I guess, in the world. And that also taught us a little bit about supply chain, where the visibility of product coming into the environment, the visibility of product ultimately interfacing with the patient, and that barcode and that ability to scan things that were being attached to the patient, including product, is so vital. So what the pandemic really did is, I think, bring visibility to the executive leadership team on supply chain. So, we took it for granted. During the pandemic, I was on the phone hours and hours of every single day sourcing product, which is not typically in a CEO's job description. But, when that N95 mask and that specific model would be a game changer in terms of, I would argue, life or death for that nurse to be able to go in and care for that very sick COVID patient. That's what it came down to. So, it was an amazing, I think, awakening of executives and leadership to understand that supply chain is just as important as a nurse, is just as important as a ventilator in an ICU room. And for me, it was just a powerful moment where I remember being on the ICU unit and watching that nurse scramble for that N95 mask that was not readily available. And that was a life and death moment for that patient, because that nurse could not enter that room and provide the care when the alarms were going off and that patient was in need of care because of a $3 N95 mask. Mm. And you look at that room had probably $500,000 of equipment in it, but a $3 N95 mask was the difference for life and death.
You mentioned a lot about leadership, right? How does leadership within Mackenzie Health play a role in driving any supply chain initiatives? Basically, what I'm asking is, how do you get people to care about it? How do you make that connection for them? Because we don't always make that connection, I think, in supply chain until we can't get what we need, like you just outlined for us.
So, I think and it's human nature, when the crisis is gone, we revert back to our old behaviors, and in many ways are bad behaviors, right? And forget that the problem is there. But the problem of supply chain reliability, supply chain visibility is still very much there. And where I think hospitals in Canada and even in this province of Ontario they went to a narrow place around assessing supply chain, which was really about the unit value of a product. So it was all about sourcing and leveraging the buy. So going out in group requests for proposals, and absolutely we know that when you go out as a collective, you can get better pricing from the vendors, but it's way more complex than that, right? It's about what's in that contract. How does that contract provide predictability for availability? How does that product then go to the warehouses, the distribution centers? How does that product then move from the distribution center to the loading dock? How does it go from the loading dock to our supply rooms? How does it go from the supply rooms to ultimately, impacting the patient and ensuring that their care is delivered appropriately and then they have the right product? So it's that full visibility and appreciation of the word that is forgotten. We call, it's called supply chain, and we forget about that last word of, how does that chain work? And if one link breaks in that chain, then the chain is broken. Mm-hmm. And every link is critical. So for me, I have the benefit of also sitting on an organization, GS1, that brings in a whole other perspective of supply chain, not so deep in healthcare, deep in other environments like in grocery and in other food areas and hardwares, And those sectors have complete visibility of supply chain. And I think in healthcare, we're getting there. We're starting to understand, how far behind we are. I've always used the example that the bottled water that you have the benefit of purchasing in my cafeteria at both my hospitals is actually more connected to supply chain visibility and traceability than the hip or knee that you have when you have surgery, because there's a universal barcode that does a very important thing. It ensures that the data is there to understand how that product came to be in the environment. So product traceability, supply chain visibility. I mean, these are all things, Dana, that I think are now front and center for healthcare leaders. And we're not just, when I first started, well, where was supply chain? Well, it was in the purchasing department. Where was the purchasing department? Well, it was in the basement, and occasionally someone went down there, right? It's way more important. So to provide complete care to a patient, all pieces have to be there, including the products and the medical devices that we use to deliver care.
You mentioned one of my favorite words, which is data or data, whichever way you like to say it. What is the role of data analytics in supply chain resilience? How do you tell that story?
So I think it's capturing the data, understanding the ability to track a product, and then ultimately, where we're working with GS1, and I actually sit on another board, the Mohawk MedBuy Corporation, which is I think one of the largest shared service organizations in the country for supply chain. There's an understanding that it's all about data. So the value add is not about the product so much as how do we have better visibility through data and data analytics of how we use that product differently. So I'll give you a great example of how analytics improves the use of product. So in healthcare, one key part of a patient's recovery is wound care, whether a wound that they're sort of suffering from because of an illness like diabetes, a wound that gets created as part of surgery. And, we do some interesting things because wound care products are expensive, but we don't have any kind of visibility of, again, wound care in the continuum of care. So more often than not, a patient will leave a hospital and then the home care provider will use a complete different set of wound care products, which poses risk to the patient, which causes all kinds of confusion. And then so how do we not know that when a patient leaves Mackenzie Health and goes home, that wound care product's going to change? We don't have visibility. We don't understand the full spectrum of the continuum of care. And without knowing there's a problem, you can't fix the problem. Without having data and analytics to understand the problem, you probably don't fix the right problem. So, that's where there's massive opportunity on understanding, supply chain in healthcare and aligning product around the patient as opposed to product around the institution. I think the other thing, Dana, that's very remarkable is the lack of appreciation of just how expensive consumables are in healthcare. Even our clinicians don't have any idea on, if I use this product versus that product, what is the delta on price? Or, if I waste something, what's the consequence to the hospital? So in the ideal state, and, we're working with this, and we've actually built our EMR system to do this with the right kinds of fields, it would be amazing if you could actually capture the data. So for example, when we're interfacing with a patient, a lot of things get embedded by a simple barcode. So the medication, you swipe the patient's wristband, you swipe the medication, the nurse swipes her ID band, and you have that complete clarity of what was provided, was it the right thing, and there's all kinds of notifications. You just got to keep advancing those things. So we actually went live, proud to say another first in Canada for Mackenzie Health, where we introduced IV infusion interoperability. So the IV pump in most hospitals, actually all hospitals right now, we're the first, has to be programmed by the nurse.
Mm.
Well, that the whole order is in the electronic medical record. So why not have that uh, medication order get pushed automatically through our wireless network to the infusion pump? And that's what happens now. So it gets pre-populated and programmed so that we're reducing error in the use of product, right? In this case, an IV medication. And the nurse simply swipes the patient's wristband, swipes the pump, swipes the med, and swipes her ID badge, and that's it. So again, it's that visibility, it's that understanding that it's an input in care delivery supply chain, no differently than um, the training we provide our professionals, no different than the huge investments we make in the most modern contemporary pieces of equipment and facilities. So I just think we've come a long way as executives because executives are talking about it, and change won't happen unless these priorities and these risks are being discussed at the highest level. So I would say to you, Dana, I have hope that supply chain um, uh, discussions are happening at board tables and at executive tables, and with partners like Mohawk Medbuy Corporation and GS1 to advance that agenda.
I love that. And that's why Scan Health is here too, to continue that conversation and shine a spotlight on why it's important. But a lot of what you talked about was the workforce. And there's always the saying of it's the people process and then the technology, right? The people is always first. So I would like to know, what are some initiatives that Mackenzie Health has in place for training and educating your staff on supply chain best practices? How do you convince them to collect this data or scan that barcode? How do you kind of make supply chain seem exciting or should be something on their radar?
Mhm. So I think any provider, whether it's a support staff member in our EVS department, environmental services department, or a nurse, I think they want to do things to the best of their ability. So, what does that mean? Well, they want to do things as efficiently as possible. So, understanding how we can bring efficiencies in the use of product and supply chain. So, when they go to that storage room or that supply room, they want to know product is there. They don't want to have to go searching around. They want to be efficient with their time. When they're using that product, they want to know how to use it. They want to have the visibility even on their computer, say, hey, the the specifications and the use of that product are there. It's already been scanned. It's pre-programmed. I'm clicking on my chart. I know how to use that wound care. The instructions are right there. We have it. Like again, we forget that we live in a digital world, yet we have archaic processes sometimes in healthcare by not using some of that digital information that's already there, right? So, the product information can easily be embedded in the electronic medical record into the workflow of that provider. The other thing that staff in any hospital or healthcare environment want to ensure is that they don't create risk, right? So no practitioner ever wants to harm a patient. We've actually partnered with a company out of the U.S. called Press Ganey, and we've been on this journey for now 2 years around high reliability, zero harm. And it's about education. It's about a whole bunch of things. It's about a bunch of tools, and it's actually appreciating that in our environments, we cause harm every day, harm to staff, harm to patients. And the use of product can cause harm.
Yeah.
So understanding that it's risky business and understanding that there are structures. So again, I think by empowering your staff and helping them appreciate how it all works, even educating them around how supply chain works and listening to them. Then it's all about listening to them. Like, every degree of success we've had at Mackenzie Health is listening to our frontline staff. Again, I go back to our electronic medical record build. I was fortunate that I met with some executives from, again, the US early on, and they said it's all about empowering your staff and getting their buy-in around the change you're going to make around the workflow. So the technology is an enabler, it's a tool, it's the change in how you want to work that's most important. And changing in how we want to work in supply chain is just as important. So, there's a massive effort around ESG now in supply chain. And our staff say all the time, and they want to be empowered to help this. How do we change all the packaging around products. How do we change the bags and bags of waste that get generated in packaging of product, right? And they want to champion those things. So, even things like reusable gowns. So back to the pandemic, we have a partner that we work with for all of our linen products. And, they came up with an idea saying, well, we have reusable gowns.
Mm.
So we can give you way more predictability because, again, back to the inability to deliver care, well, not having enough level 2 gowns in the COVID environment actually was a rate limiting step to deliver care. So we were urgently looking for more gowns, no differently than we were looking for masks. And that understanding of, hey, one of the staff says, well, why don't we go to reusable gowns, right? They came up with the idea. So we engage our staff in so many things. I don't think we have ever started to engage them the way we are now on supply chain. And they know because they touch the stuff every single day. So I think that's Dana, the biggest awakening. Let's engage the staff in how to better use supplies and products.
One thing that stood out from what you were saying is reusable gowns and almost like sustainability. I think that I haven't really had this conversation so far yet, but supply chain and medical supplies do take up quite a bit of waste. I know in America at least, like it's one of the largest chunks of pollution and whatnot. So I don't know, have you thought about that at all,
No,
Mackenzie?
no, and it's like the company we work with is called Ecotex, and they said, look, it's gonna. They actually presented a business case, and I said, well, right now I don't even need a business case. I just need gowns. So just give me some gowns. But then they shared the business case on the impact and the reduction on the environmental footprint by using reusable gowns, and actually how much money we're saving than the disposable gowns. So there's a lot of companies out there, but the irony of this is it takes our frontline staff for us to understand some of these things, and that's where I think we've shifted our approach, where we would talk about everything from staffing to clinical training to equipment. We consult our staff on so many things. We've just started now, a little too late, but better late than never, engaging them in supply chain.
I always argue when anybody ever talks to me about creating a digital solution or they're a startup, I always say you have to have a clinician from the beginning because they have a line of sight into so many things that maybe you never thought about. I think sometimes when we manufacture medical supplies, we don't have that voice there to tell us in practice, actually, this may or may not work. So I always advocate for that. So, but I have one last question for you. Looking to the future, I know as the leader of Mackenzie, you kind of have to look what's next, but how do you see the future of healthcare supply chain and how are you working to sort of anticipate or manage the impact of changes?
Yeah, I mean, I think we're going to get better on data capture, and I think barcode technology and things will give us sort of a better line of sight, and then give us the analytics and the data that you talked about. But I think for Ontario and Canada, in a centrally universally funded healthcare system, I think we need to get to supply chain across the system.
Mm.
So as much as it's driven by the silos of care delivery, long-term care, primary care, hospital-based care, I think integrated supply chain will go a long, long way. And I think that's where many organizations are now turning their focus. In Ontario, we have a structure called Ontario Health Teams that brings in community-based providers and hospices and primary care. I think as we start to look at product across the spectrum of care delivery, I think we'll be in a better place. I think it's already done in US as you have large organizations like Kaiser Permanente that, procure probably as a system provider. I think that's where Canada and Ontario needs to go, and kind of leverage both contracts and the size of those contracts by having some universal contracts, the visibility, so some of the smaller players don't have that capacity to source product and have the technology to support it. But I think working as a collective, in a very simple way, Dana, focusing supply chain not around delivers of services, but around the patient. So we always talk about patient focused care. Well, maybe we need a word called patient focused supply chain too.
Altaf, I want to thank you so much for your time today. If somebody, one of our listeners, wanted to learn more about Mackenzie Health or contact you, are you on social media? What's the best way?
Yeah, I'm not a social media person, but our website is there, Mackenzie Health .ca. So do look at our website, and my contact information is on the website.
Thank you. And if you enjoyed today's episode, don't forget to share your thoughts and feedback. Until next time, I'm Dana Trampus, your host. Stay tuned, the Scan Health can.